Removing an exposure or trigger for your anxiety, it's like a short-term band-aid, but it can actually worsen the overall problem.
As humans, we experience a wide range of crazy emotions, and these emotions can come up during challenging times that seem to hit us out of nowhere. That's the purpose of this podcast, to teach you how to move through these difficult situations and harness these emotions that we feel to be able to create the life that you want. My name's Nathaniel Burke, and I'm the host of the Emotional Fitness Podcast. I hope you enjoy. All right, Dan, well, thank you so much for being here. Actually, it's Dr. Dan. That's the thing we call you on the football team.
Yeah, some people do.
Yeah, that's right. So thank you so much for being here. I'm really excited you're here because of the work you're doing, and I'm so interested to hear on your thoughts on being emotionally fit and what that looks like, especially with kids. And I'm really excited to really explore that whole avenue with you. So thank you so much for being here.
Thanks for having me.
Yeah, so maybe just quickly tell everybody what specifically you practice you're in, what you're doing, and what that looks like on a day-to-day basis for you.
Okay, so I'm a pediatrician. So I actually did my training down in the States and moved back to Kelowna 2 years ago now.
Oh, wow.
Which is where I'm from.
Okay.
Mostly grew up here. My wife, I met her here, so she is from here as well. So we had big ties here.
Yeah.
Pediatrics in the States is a little bit different, but it serves babies till the age of 18.
Okay.
And so you get a wide range of different issues and concerns mentally and physically with different diseases and stuff among, younger children versus teenagers. They're essentially adults. So you have to kind of understand the differences at the different ages, but it also gives a bit more variety and interesting things because it's not only one population being pediatrics, but each different age group can have a variety of different things that you're thinking about.
Yeah.
In the States, I preferred the hospital piece because it was more interesting to me, whereas the clinic side of things in the U.S. was more primary care, like a family physician for kids. So if you had a sick kid with a cold or an ear infection, you'd see a pediatrician. You just go to the clinic and see a pediatrician. You didn't need a referral or anything. But here it's structured so quite a bit differently. So everyone sees a family doctor.
Okay.
And if the family doctor feels like they need the pediatrician's advice, then they'll send a referral to see the pediatrician. So as a pediatrician here in clinic, you're getting the more difficult cases or the ones that require more follow-up, or things that have already been kind of weeded out by the family doctors in clinic. And so I find it a little bit more interesting in clinic in Canada, which I quite like. And I have done some hospital stuff here as well. When I first moved back, I did a lot of hospital stuff, and slowly over the last couple of years have been kind of shifting more to the clinic side of things.
Very cool.
For a variety of reasons, but a lot of that being work-life balance and just my specific interests, and I guess I would say my specific areas of strength being more suited to a clinical practice here as opposed to how it was different in the US. So
Very cool. So to tie on that, what would be some of your strengths, you would say?
So I really like being able to sit and talk with my patients and connect with them on a deeper level and give them time to be heard. And while that is important in the hospital tends to be busier and you're kind of moving from one task to another. And you get a lot more interesting and urgent things, and which I do like to a certain degree. But it's not so much reaching into their life as it is into that moment. And obviously that moment in a hospital with a sick child, you have a pretty substantial place in their life, and you can make a big impact on their life. But with the clinic side of things, I like that we just get to sit and talk and really understand where they're at and how to help them moving forward, and then you get that follow up, and so I think that's one of my areas of strengths. I find that you always hear these stories of a doctor who doesn't have as much patience or doesn't really listen or isn't as understanding. And I feel like I've and at times I guess I have struggled in that area depending on the time, but as a whole I feel like that's come more natural to me, to be able to sit and listen and kind of take everyone for where they're at, rather than kind of putting my thoughts or opinions in, and then if they don't like my recommendations then they can go find somebody else. It's more, okay, well, let's find an in between then. If this is what I want and you're saying you can't do that, then let's find somewhere in the middle where we can both feel like, you know, we're making progress but not completely throwing your life in a flip kind of thing.
Right. And that's really cool, because I feel that one of the downsides that I would say, being a parent, being somebody that has been through different medical things, I mean, to be honest, actually not a lot, but my wife and different people knowing that have been through there, that seems to be a key component that's missing, I would say, and I can't blame anybody, because you're right, at the hospital setting they're getting tons of people coming through. There's a high stress scenario, like it's a lot going on, but I do think that's something that's missing. So it's really cool that you're doing that. What are you finding is the biggest impact you're having, or what specifically are you noticing that your patients notice that you do differently then? Like you said, you're listening, but do you notice that they notice it?
I have, actually. That's, I think, how I really started to notice it more. Where some comments that the parents are making are really standing out, like, oh, this isn't typical or what they've experienced in the past, and they've intentionally gone out of their way to say, like, we really appreciate that you're hearing us and listening to us. And just today, one of my patients' parents said that they think part of the changes that they've seen with their child over the past few weeks is partly due to the fact that they felt heard in the office by me, and that somebody is working to help them rather than just labeling them as having this, that, or the other thing. And so they're seeing themselves differently as a result. And so those types of things really stand out to me and make, like, they're really valuable to not only kind of provide that feedback to me, but also reinforce the same behavior, so that even though things get hard or difficult with the patient, or there's frustrations between me and a patient, remembering that is such an important piece of that relationship, so that I can continue to kind of push that through, rather than allowing my emotions to kind of overcome me and just become frustrated.
Right. I like what you said there, and how, especially with the kids or the people that you're seeing, and being able to make that impact, have you noticed that people coming in have been labeled something and they latch onto that identity, and then you look at it and go, that's interesting? Like, do you see that come through? When, a good example is ADHD, right? I heard some people going over a conversation yesterday, and they're latching onto that identity. Do you find that that's common?
Yeah,
like people getting attached to labels and identities and that kind of thing.
It does happen. I don't know enough to say whether that's a majority of the time or not, but definitely some people, they do feel like they sort of latch to a label, and that could be for a variety of reasons. Of
course.
And some may be good, some may be bad. Like, they're taking ownership of their personality and, like, the challenges they have, and saying, I have ADHD, that's just kind of how I am. And but I think the important thing is using that to learn how to then shape themselves. Whereas sometimes people will use it as an excuse or a write-off to say, I have this, like, you can't fault me, that's just how I am.
How often do you, I guess, again, it's hard to say, but that's something that I find really, it's hard to sympathize with sometimes, for myself, even when you hear that, because it's, I'm just this, and you're just accepting this identity that, true or not, you're just accepting that it is, when it doesn't have to be, or this can be true and I can be this. So it's almost like it's almost an excuse for behavior. And that, I think, is a dangerous part, because not only do kids do that, And I've seen my daughter do it. She said some weird things sometimes, and I'm going like, kid, like, you don't even know what you're saying, but you just heard it once and you just thought it sounded cool, and now because you've had that once, now you think you're that person. But having, I think people, we sometimes attach to that, and we just, again, it becomes an excuse.
Yeah, and I think that's a good sort of reflection to have for each individual person, and say, am I using this as an excuse?
Yeah.
But it becomes really difficult to identify that in a person, because you can't really fully understand who they are, where they've come from, and what experiences they've had. And that may be just their outward kind of statement or appearance of their experience with life, and in reality maybe they have been through a lot of other things. Maybe they've tried to improve, and now they're just kind of accepting it because they're saying they're trying to show they're okay with it, but maybe they've really struggled in the past. And so it becomes really challenging in that way, but can be hard to in a moment really understand that, and it can be easy to place judgment in some situations.
I was going to say, it's got to be one of the toughest things, is to, I always like to put myself in whoever I'm talking with in their shoes. And I'm sitting, I'm thinking, okay, I'm sitting there talking to somebody, and they're telling me about this and this ADHD, or let's just use that for an example, because we're talking about it, but then they have this going on, they're doing this, and these things come up. It'd be very difficult not to, one, pass judgment, for sure. I know for myself, for sure, to keep myself in check. But then to two, I think even before that, is to get them to open up. So my question then is, how do you get them to open up? What are some things that you do to help them understand that you're actually just there to help, not to just push the next label on them?
Yeah, that can be really tough, and you never really know if they're opening up fully. And I say that's okay. Usually I'll even mention that, like, I always, for adolescents and teens, have an opportunity for us to chat one-on-one. And what I say is, it's a time for us to just get to know each other better, ask some more deeper personal questions. And whatever you're comfortable sharing is great. And if you're not comfortable with anything, then we don't have to talk about it. And maybe another time we will. But it's about building that trust and that connection. And I think part of doing that is how you respond to different things that you're talking about. So if everybody has things that are not ideal about their life, right?
Of course.
And the way you respond to a conversation about something that's not ideal can really help to direct, how they feel about you. So if you do come out right after they say something like, oh yeah, we go out for dinner 3 times a week for fast food, and you come out and say, oh yeah, you really shouldn't be doing that, like, don't you know that's not good for you? They're automatically going to be pulling themselves in, right? But if you were to say something non-judgmental, or like, oh yeah, like that, sometimes it's really busy, and in today's society it's really challenging to make the right choices. Everything's focused on convenience, and just showing that understanding will help to open them up, right? And so it's important to build that connection before trying to implement change in somebody, because you can't force anyone to make a change. You have to, they have to be willing to and want to, right? And so if you're not building that trust in that relationship, they're not going to want to take any advice from you.
Yeah, I love what you said at the very beginning too with it, is that it's trust. There's a really great book by Stephen Covey Jr., I believe, M.R. Jr., can't remember the name, but anyway, called The Speed of Trust. And it's so wonderful because it goes through a range of different ways to build it, how to build it, the value of it. But essentially, the biggest one being in relationships, and how valuable it is, and how it's a key ingredient. It's the cornerstone, if you will, or the kingpin of that relationship. So again, if you have a patient or anybody that comes to you and says, hey, I'm going through this, and if right away you, even if meaning well, because I think that's where a lot of us make mistakes. Again, I know I've been there, guilty before, is, oh, well, like, hey, like, come on, like, you should, this is, why are you doing that? Here's the best way, and I can help you. You're right, you're going to get them closed down. So building trust, I think, is such it's a really good point that you brought up. So then how do you, if somebody is closed down, do you share some of your story, or how do you show them trust if they're not willing to share?
Yeah, it can be really challenging, and I think it depends on the situation and the person, right? So you kind of have to be flexible in how you approach a situation, and sometimes it's as easy as saying, okay, well, today we don't have to have our chat. We don't have to talk anymore. Like if you're not feeling open or comfortable right now, we'll just try again next time. And and so allowing them to have that sort of control as well is important, because if you force a conversation and try to dig deeper, you might just close them off even more. Sharing personal experiences can also be very helpful.
Right.
And then reflective listening is important in all situations, really, but it can be a very valuable tool in those situations where you feel like they're not receptive to hearing what you have to say. Right. And instead of telling them something, you ask more questions and try to get them to say what you want them to say. Yeah. And so if somebody's talking about substance use, and you just ask, like, well, tell me a bit about it. Like, what's it like when you use the substance? Like, how do you feel, and what is leading you to use it? And do you feel like it's helping you overall? Is it getting rid of the problem, or is it just a temporary thing? And do you feel like that's good for you long term? And just having them answer these questions rather than you just telling them all these things. Plus, it gives you a better sense of their understanding of it, and maybe they don't know all these potential long-term complications or what's actually happening when they're doing certain things. And so that reflective listening can help you understand them better, but also get them to sort of think of, oh, yeah, actually, it probably isn't helping me in the long term, and yeah, you're right, I probably could reduce what I'm doing, or and so reflective listening can be a valuable tool. And I actually had a patient who was referred to me for mental health concerns, and she was very closed off and wouldn't talk to me at all. I was talking to her, just to her mom, pretty much getting information and everything, and she refused to answer any of my questions, and she refused to talk to me at all in person, and that happened probably for four to five visits. She wouldn't talk to me. But we didn't force it. Yeah. And eventually she slowly, she would answer a couple questions, and then finally was willing to, have a one-on-one discussion and get to know each other better. And and I was going to say, sometimes people might get frustrated that they're like, well, if they're not going to talk to me, I can't help them, right? And then they'll just say, like, go find somebody else. And then I remember that actually happened with that patient. They were seeing a different physician for their concerns, but they weren't willing to take their recommendations. And so they were kind of passed on to find somebody else to help them. That, allowing them to have that choice and control over whether or not they talk or open up or have a one-on-one conversation, I think that alone allowed that trust to build and grow. And so he's not going to force me to do or say anything. And then the more times we met, and the more she heard me talk to her mom, and the more she got to understand who I am and build that trust. And now we have a better relationship, and she's doing a lot better. And that was a pretty dramatic example for me too, to kind of recognize that you really got to meet each person where they're at.
Yeah, it's so cool, because I find, again, the word that kept coming to my mind is patience. Like having a lot of patience for that, and to be able to just sit and just be okay with this person just not. It takes an incredible amount of patience. That's something that I'm definitely working on in my life. My wife, Emily, she bugs me. She kind of pokes every once in a while when I don't have the most patience, especially with my own kids. But that's really cool, that just having that patience, and like you said, letting them have the choice of not engaging in that conversation. And when I thought it was the coolest, like I said, it worked and opened up, and something that I think as parents, or really anybody, is like a little easy way to build that trust is just saying, hey, you know what, we don't have to talk about it, right? But I'm here. And I think it sounds, to be honest, more like a big part of your job is counseling, truly. Like not to be like, this is, write it down, but like quite literally, like it is though, when you think like all these tools you're using, it's a lot of coaching, a lot of counseling, and really like some of it I'm listening, I'm like, these are sales techniques that people do. I'm like, damn, the sales guy, like what's this? But it kind of is true, because what are you doing in a sales transaction or with any transaction? You're trying to build trust. You're trying to build a relationship and offer them a solution.
Right.
And so that's exactly what you're doing here, which I think is cool that it's amazing that you're taking that approach in your field. Because you're right, I've seen this unfortunately too many times where it's, well, this, okay, fine, well then that's okay. I'll see you later. So to have the patience and willingness to do that's really cool. What makes you want to do that? Like what was starting you? I mean, we're kind of going off track, but I love it. Is what was like the key thing that you really wanted you to get into being a pediatrician?
I don't know. I feel like my life was just kind of on that track from the beginning. Mm-hmm. I always loved working with kids. Even when I was like 10 to 12 years old, like at church, whenever there was a family there with a young child or mm-hmm. a baby, I would want to go and play with them in the playroom and mm-hmm. entertain them and keep them happy, and helping out with like kids programs for like vacation Bible school programs and stuff like that, and then working at summer camp, and then in medical school and residency, or in medical school, every time I was on a rotation where there was a kid involved, that interaction was just, it brought me more enjoyment.
Really?
And I liked everything pretty much in when I was going through medical school, and all the different aspects of medicine. There was something about it that I enjoyed. But whenever there was a pediatric patient in that other specialty, I preferred that. And then when I did my pediatric rotation, I just enjoyed it more than, like, I lost track of time. I wasn't in a rush to get home. I stayed late, and I enjoyed it so much more.
Very cool.
And so if I did another specialty, the ones that I was considering were also going to be into a focus with kids.
Very cool.
But I liked the idea of being more broad and not kind of focusing on one narrow aspect, but being able to kind of be more of a broad pediatric physician.
Very cool. And I think with how you're doing it, you're able to, I feel like a lot of kids, and not even just kids, but people in general sometimes need somebody to just sit there and let them just sit and be okay. And so what I'm getting at is you can make a big impact that way. I mean, you think about the kids that you've helped, and some of them, like I said, that girl, clearly that helped a lot. But even just other kids knowing that, hey, I remember going to see that guy, and he actually didn't say I was anything, and he just was there, and he was just nice. And so what I'm getting at is you can change their perception of the medical system, of seeing doctors, especially if there's somebody that is going through a lot of stuff and has a lot of challenges. So they're going to see specialist after specialist after specialist, and to be that one guy, hopefully there's more. Hopefully everybody's doing that, but even if you're just one of those people that has been just a positive light during the journey, I think that's really cool. So I did want to ask you, clearly, especially now, today's day and age, there's a lot of, seeing anxiety, ADHD, you pick it, it's on the rise, it seems like. What are some of the biggest things you are noticing coming through your clinic when it comes to kids, and specifically with emotional health?
Yeah, like you said, you listed several things that are on the rise. I think pretty much across the board, there's an increase in just mental health challenges in general. Mm-hmm. I think the biggest one that I've been noticing personally in my practice is anxiety, and different types of anxiety, but just in general anxiety, and some so severe and debilitating that they can't even leave the house, or they're not in school anymore, and they're doing online school, but how much are they actually doing is unclear. And it's tough, because if there's a certain or specific situations that are major triggers for that anxiety, and then you remove yourself from those situations, over time it becomes so much harder to put yourself back into those situations. So removing an exposure or trigger for your anxiety, it's like a short-term band-aid, but it can actually worsen the overall problem. And so it's really sad to see how many kids, haven't been able to integrate back into school after the COVID shutdowns. And when people do start to struggle with severe anxiety and they're out of school, we really try to encourage them to at least maintain partial attendance to school or do a gradual reentry to school, because that complete removal of that environment that is causing the trigger, or is a trigger for their anxiety, it doesn't help long term. And it's really sad to see how much some kids are struggling with anxiety at even such a young age, like 8 or 9 years old, and they can't go to school. It's and it becomes really difficult to help them. I mean, I have 2 or 3 patients who their anxiety is so bad they can't leave the house, and so most of the time they can't come to the appointments, and we end up just having to do phone calls. And and it can be really difficult to support the family and the patient in those situations. And I don't know, it's probably a large variety of factors that are contributing to that more recent rise in mental health concerns, but like the COVID restrictions resulting in people not attending school, and then those who already had some mild anxiety symptoms, or social anxiety or school anxiety or separation anxiety from their parents, and then all of a sudden they don't have to deal with that anymore. Now they have to go back to it, but they've been out of that scenario for so long, it's that much more difficult. And and social media, obviously. And I don't remember if it was a U.S. guideline or not, but there was a government sort of recommendation to not allow your children to have social media until they're 14 years old. And somebody was kind of pointing that out and saying how significant the data must be for the government to make a broad recommendation like that, because they don't make willy-nilly recommendations and guidelines.
Especially with that,
So there's a lot of things that are contributing to it, for sure. But it's really sad to see how much of a problem it's become for a lot of kids these days.
Yeah, and that was, first of all, there was a lot of really powerful stuff there, and the one thing I really wanted to touch on was removing the trigger, because I feel like as society that seems to be, we're so conditioned to the quick fix, right? And so when here's a quick fix, I can just do this, but you're removing the trigger, which in my head, the first thing that, as soon as you said that, I'm like, I feel like not school as an institution, but school as a group, school as classmates, people they get to be around, their tribe, if you will, or their little community. I feel like that's the answer. There's some really good saying, it's life's about we, not me. And when you, really good tool Jordan Peterson talks about with, if you have, again, obviously kids are in a different scenario, because I don't know if they have the self-awareness, but with adults, he talks about if you're having social anxiety, you put the attention on someone else. You help them feel comfortable in the social setting that they're in, and then you putting your focus there, so then you don't feel that. So what I'm getting at is, it's interesting that that's the first thing that they're wanting to remove. And my head went to right away, I'm like, I feel like that's the first thing that they needs to stay. That they need their friends, or to make some friends, or to feel a sense of belonging, feel a sense of purpose, feeling a sense of community, and that they have their friends, that they have their, especially I'm thinking of elementary school, middle school, that they have their friends that they can have their weird games with and have a bunch of fun, and life just kind of disappears while they're doing it. And so to remove that, it definitely is counterproductive and very reactive, right? Versus looking at the long term. And I've never been there, thankfully, but I know my wife's experienced really bad anxiety, so I've heard her side. And hearing yours with that is so interesting. So it makes me wonder, what are some things that you would recommend people doing to avoid that, or some habits they can put in place now for themselves and their kids?
Yeah, that's could be a huge discussion all on its own.
Yeah.
I tried to kind of distill that down to a couple points, well, more than a couple points. So I want to make sure that I touch on them. But specifically, if we're talking about what a family can do for their kids, having a stable and safe family environment has a massive impact on a child's well-being and emotional health as they grow up. It can be really, unfortunately, glaringly obvious when a child comes into my office and they're struggling with behavioral issues, and then you pretty soon realize or hear that the family dynamic is just out of sorts, and it becomes clear that the child's acting out because of the situation. So having a stable home environment, a loving environment, is critical for them to feel safe and loved. One interesting piece of that, there was a study that kind of looked at different types of parenting styles. So permissive parenting versus very strict parenting, and loving versus unloving parents. And they combined the two things. Sorry about that. And they looked at parents that were permissive and loving versus loving and strict, and then permissive and unloving, and strict and unloving. Okay. And so obviously, or probably pretty clearly, the unloving and strict was kind of the lower end, because they had kind of two struggles going on there with conflict and not feeling loved. But then the next lowest one, what they found was that having an overly permissive parent was better than having having an overly permissive parent was more negative for the child than having a parent who's unloving. So if they were permissive but loving, that child would struggle more with emotional stuff than if the parent was loving but really strict. And so it just kind of really stood out that permissiveness, they really need to learn and understand boundaries and consequences, and that structure in life is so critical for their development.
Wow, that really that's interesting, because I mean, me and my wife Emily talk about this lots with the kids. Is like I made an analogy today with her, and obviously there's no perfect way to parent. There is no perfect way to parent all kids, because kids' range is just so different. Some kids need my dad raised 8 kids, which is crazy, and he said the same thing. And it's like, okay, so like here's a guy that's been through a lot. You can see, okay, there's a different way to raise certain types of personalities. But my wife and I have this conversation of like, our beliefs and our values don't line up with the other side of the family. And there is back and forth between the kids. And so we sometimes we'll have to just do the things that we believe are best, even if that means it's going to make some contention. Do it at a place of love, and explicitly mention that, and explicitly explain that. Like, this is out of a place of love. This is out of a place of, because we feel like this is best for you, and here's why. And we're not all overly strict where it's like you can't do anything, but having guidelines on things like phones, screen time, getting them to exercise every day, trying our darn best to make sure they're socializing with other kids, because that's what makes life fun, is just having other people around us. So we always kind of adopted this new mask of like, we have to be the Batman parents in The Dark Knight, right? You watch The Dark Knight, where it's like, don't be the parents to your kids that they want. You have to be the parents that they need. Yeah. Even if that means that sometimes you're the bad guy, even if that means you got to put on the mask and just say, okay, that's okay. You can lash out at me and you can be upset because I'm telling that you can't have a Slurpee every day after school, and eating your veggies is better for you. And we've had those conversations and getting them to help us clean the house and doing all that. Even if they're upset about it, it's like and sometimes, like, to be honest, there was like fights, like actual like screaming matches, and you're like, this is crazy. But ultimately, it's gonna make them better adults,
right?
Because everybody at some point in life has to learn how to cook and clean and contribute, and you know what I mean. Like, we learn responsibilities, and what it does, and I would say it ties back into the anxiety thing, is that when they have this list of skills that they know that they can take on and have heard the word no and have had some small rejections, taking on the bigger things is easier. Going to school and yeah, maybe they don't like school, but they can take it on and handle those little stressors. So going back to before, if you're removing all those stressors, well, now you're just wrapping your kid in bubble wrap, unfortunately, meaning the best, but it's not actually helping them. So needing those little stressors, that's what I say, is like, I'm going to like just constantly give those little stressors to, and I even said that to my kids 2 weeks ago. I was like, I'm going to make you guys do some stuff once a week that you don't like, just to make sure you know how to handle little stresses. Because yes, they're from a split home, but they have it pretty darn good, right? So little things that can just make it challenging. No, you can walk to school today. Yeah, it's a couple kilometers. You're fine. I used to do it. Kids do it all the time. You're okay. Stuff like that, right? Like just little challenges that will hopefully grow them into somebody that can handle the big stuff.
Right.
So
I should clarify. I think I misspoke about the group in that study that was worse off. It was the unloving and permissive parents.
Okay.
Because they didn't feel love from their parent, and the fact that they were just allowed to do whatever they want felt like there was no care. They didn't care about what they did.
That makes a lot of sense. And to be honest, some people that I know that I can't say unloving because I don't know them specifically, but if I were to look from the outside and observe, that would have been my feeling. And you can see what type of result that has. Yeah. And it's pretty sad sometimes. So that's really interesting.
The other aspects of what you can do, not only for your family and your kids, but for yourself, that I think have gone kind of underappreciated for a long time, is just healthy lifestyle stuff in general. Yeah. So the number one thing I like to ensure is on track initially is a healthy sleep schedule. If you're not getting adequate sleep, you can't expect much from yourself in terms of functioning and health. Like actual aspects of your physical health are worse and inefficient even after one night of poor sleep. Yep. And so making sure you're on a good sleep schedule is critical. Like if I go 3 nights with inadequate sleep, like I feel like I have ADHD and I'm much more like not tolerant and irritable, and I get angry quicker. Like and that's going to happen to anybody. So if you are already struggling with things or at risk of mental health concerns, sleep should be a priority. And then nutrition is a huge factor too. Right. Making sure you're getting adequate fiber in your diet and protein in your diet, and reducing the hyper palatable, hyper processed foods that we're overeating. Yes. In today's day and age. It's just so it's convenient. It's everywhere, and it's cheap. Yeah. It's
so cheap. I mean, we compare all the time. Every time we go shopping, I'm like, hey, I can get the farmer's market. I can get this. It's grown naturally and locally, or I can get these Pop-Tarts over here. And you're like, damn, like that's crazy.
Yeah. And it's hard to even know. And it's like, you think you're eating healthy, and then you take a closer look and you're like, oh, okay, maybe there is still a fair bit of room for improvement. Just because I feel like nutrition isn't really talked about or learned in the normal kind of like life. Like you don't learn much about it in school, if anything, and even in medical school you don't learn a ton about nutrition. So it can be challenging. It's
your building block. And something I want to touch on with the sleep I thought was interesting. I heard Andrew Huberman talked about that. Dr. Andrew Huberman. He's got some wonderful research and stuff he's putting out, but he talked about even just 1 hour deviant from your normal sleep schedule. Now, mind you, this is for adults, so I'm curious with kids. I think you said a 17? I say 20 to 17% reduction in performance the next day, even if you're sleeping more. So it made me think, with kids, one, what is the normal range? Because this is a conversation I have with my daughter all the time. And I will say she is a go-getter. So like, I absolutely love her for that. She has more drive than most 14-year-olds you'll ever meet. She'll get up early in the morning to work out, go to the gym like almost every day, which is amazing. But on the flip side, it's like she wants to stay up. So my question then is like, obviously there's a big range for kids, but if you were to say like, what is like healthy ranges in your opinion?
Yeah, that's tough.
Yeah, of course.
So
Yeah.
there's recommended ranges.
Sure.
And it's different for all the different age groups, and it starts at, I mean, you know, babies are sleeping pretty much 22 hours a day, right?
Yeah,
it slowly decreases, and then toddlers, or maybe 2-year-olds, they're still napping. They're sleeping maybe 12 to 14 hours at night, and then they're having naps during the day. They're getting probably 16 hours of sleep or so. And then as they drop the nap around 3 to 5 or whatever, they're probably still sleeping 12 hours at night, 12 to 13 hours. And then it just slowly kind of decreases as they get older. Into adolescence and teen years, you generally would hope that they're going to get 9 to 10 hours of sleep.
Right.
But it's tough because, I mean, there's good studies showing that teens have a natural shift in their sleep schedules and patterns, that they just naturally are awake more at night. And that they function better starting, like if a school program would start more like 10 o'clock.
I remember reading that.
Better.
Yes.
But it's not set up for that, right?
Yeah,
and so,
high schools aren't set up that way, yeah.
So they're stuck getting up early and not being able to sleep until a little bit later, and so they're not getting quite the sleep that they probably should. How much sleep I try to guide is tough, and it really depends on each person. So if it's
loaded
clear,
question.
yeah, if it's clear that they're not getting enough sleep, so anybody getting 6 hours of sleep is not going to be ideal, right?
Of course.
But if it's a teenager who's getting 8 hours of sleep, obviously maybe they'd be better off if they were regularly getting 9 or 10. But if they're still successful, they're waking up, they have energy, they're not tired throughout the day, they're not taking naps, they're not falling behind on things, right? They're overall still doing well and feeling rested, then generally I say let's just kind of continue and monitor and see if they start to have any challenges arising, or if their sleep starts to cause problems, because maybe they will manage okay with that, and how much can we really affect? Like, you're not going to get your teenager in bed by 8. And then adding that level of stress, saying you need to sleep, or scaring them. It's like, I need to be sleeping now, but I can't fall asleep, and then they're spending an hour or two in bed
just
stressing about sleep, and then their sleep gets worse. And so it's all about kind of like where you're going to get your benefits and what your cost of it is. So So yeah, sometimes it's not something that I stress too much on, but there are definitely cases where it's clear that they're not getting adequate sleep, and we have to try to adapt their schedule.
Have you noticed any, again, loaded, but as even just sleep being like you said, it's a low hanging fruit, but have you even noticed effects just of, hey, we change the sleep and boom, anxiety maybe, or maybe their stress levels, or maybe, ADHD?
Yeah, I mean there is studies to suggest, I unfortunately don't have them on mine, but that adequate sleep will improve your mental health quickly, right? Yeah. Not resolve it necessarily, but have improvements.
Totally.
And I don't think I've had any specific patient who had a dramatic change in their challenges just based on changing sleep, but as an overall picture with making different adjustments and sleep being part of that, they do see progress. And myself personally, I have seen sleep having such a big impact on me. I've gone through phases where I would just survive on less sleep than was ideal for me, and I would survive would be a good term for it, right? Not thrive or feel like I'm thriving, but and then when I do make more intentional shift to getting adequate sleep, I feel so much better. I feel like more energy, and I feel less stressed. And so more anecdotally, 100% I have seen that. But then so for sure. I think sleep is one of the top things that if you're not optimizing, you should be, because optimizing other things but giving up on sleep, you're not really going to see the progress that you otherwise would.
That's a really good way to put it. And that's kind of always been my mentality with addressing any problem, really. Just with my kids or even in my own life, is like, I draw a pyramid and I'm like, okay, what's like the most important, right? Sleep, okay, my food, fitness. Like, I kind of have this checklist where I go, I'm going to address all this stuff first. And once I address all this stuff and I still have a problem, okay, I need to go see Dr. Dan. Well, not Dr. No, I won't see you, but I need to see a guy like Dr. Dan. But I do it because I want to take ownership of my own health. And I think that's maybe a thing that we're starting to see a shift in. But I know my parents, and definitely my parents before them, or my grandparents, it was the doctor's responsibility. Health was the doctor's responsibility. And whatever the doctor said, we do. So you're seeing a shift in that, which I think is good. And it takes the pressure off of the doctors, because now for every sniffle, sneeze, and all these little things, that something as simple as maybe a little more sleep and move away from sugar, you can make a massive impact in somebody's life, or you could make a big impact in somebody's life. And now we're not weighing down the medical system and all these other things that can go along with that. So my question for you is this, is that if you were to make a pyramid for emotional health, let's say specifically for teens and kids and teens, what would that pyramid look like?
Yeah, I would probably, without spending a lot of time really analyzing all the different aspects, I'd probably use the same things that we're talking about with what you can do starting today to make improvements in your health. And I would probably put sleep as the foundation. Like, that's the primary thing that you need to focus on. I'm going to just reference my list here again.
Good. No, I love it. So we have lists.
And then I would probably go with nutrition next. And then physical activity. We didn't get to that point yet, but physical activity. There's some new studies now suggesting or showing that that moderate intensity physical activity, where you're getting your heart rate up and like you're really working, you can't continue a conversation. Doing that on a regular basis throughout the week is as effective as antidepressants for anxiety and depression.
Wow.
And we've always known that was an important aspect of mental health and wellness, but having now a study to say that it's as effective as the drugs we're using to treat it, that really gives more firepower on my end too, to say we're not just relying on drugs for this. Like, that's not the answer. It's a tool that we can use, but that's not the treatment. That's a supportive tool. The treatment is, well, now that I'm talking about mental health, the counseling and lifestyle modifications, and then as an adjunctive treatment in some situations, medications. But so physical activity being of great importance, I would put that there under nutrition. And then probably, and this one probably would vary depending on the situation, but dealing with your traumas, if you have traumas, or past other mental health challenges. So if you
like emotional and like mental challenges.
Yes. So if you already struggle with anxiety or depression, or you've had trauma in the past, any range of trauma that you may feel is not impacting your life at this point, if it was a childhood trauma, if you haven't actually taken time to address it, you may be surprised how much it's still affecting you. That stuff lingers in the body, and it affects you mentally and physically. And there's a scoring system called adverse childhood events. And it's a variety of different experiences that a child could have in their life that is considered adverse, right? And there's a lot of, it's been studied a lot, and so there's a lot of good research behind it, that the more of these that you have had in your childhood, the higher risk you are at of not only mental health concerns, but actual like physical disease and medical problems as an adult. And so recognizing those risks is important, because then you can actually work on correcting the negative effect that they might be having on you that you might not even realize. So I think that's a big piece of that too, is really evaluating, what traumas or adverse experiences you may have had, and then really trying to be open about how that might be affecting you. And those types of things, they build our framework, right? The way we perceive the world and respond to the world. And sometimes it's positive and sometimes it's negative. And so it's important to really take a look at that and analyze that and see, what changes you might benefit from making in terms of your experiences from the past and how it's affected you.
Yeah, that's huge. And I love that you brought that up, that one, that they have this test now, or a scale, I'm assuming, a questionnaire type thing, that they can do that. And as you said, understanding that the mental and physical go hand in hand. Because for years, I can't remember the guy that started it, but essentially where they said, no, the brain's this and the body's that, and we kind of separated the two. But now the more and more they're going like, no, that's not the case at all. And it's interesting because a few episodes back, I've had a few conversations with people where they had huge childhood trauma that is now showing up in the body, that is now causing these things. I've had this on a small scale on my own life, where I was having some like stomach issues, digestion issues, and it revolved around anxiety, some family stuff that was going on. And I was like, hey, we're moving through that. And then I started to have those same thoughts come again. Well, guess what? I started having the digestion. And it was, again, very small, but I noticed it. And I went, oh my God, wait a minute. This is my brain saying, hey, remember when you think these thoughts? This is the feeling you get. And I had to have to stop and be like, whoa, this is crazy. And again, it wasn't a big thing. So my point there though, is that that's a small event in a conversation as an adult. People that have had trauma, and there's unfortunately too many of it out there, that will show up. Yeah. I've done my own counseling, or done counseling with a somatic therapist, and we went over some of my own trauma, and it's wild to understand how the nervous system holds on to that. For myself, a lot of it was playing football and having concussions, and realizing like my brain essentially, we kind of went over and explained that she did a test. It was really cool. I've talked about it before, but it was just wild to think about. But where it was my sensory nerves from here were just essentially all blocked out. And so, because when I played football, you would use your head as a weapon. Like that was just how I was taught to tackle with your helmet. I was taught to, block and do all these things with your helmet. So your head was this weapon. And to be honest, it worked in terms of like results. But the other side effect was concussions that I actually didn't even know I had. Right. And so when I did this test, it was like, okay, close your eyes. And she would throw a beanbag near my feet, and I would have to keep my eyes closed and drop a beanbag wherever I thought she dropped it. And it was interesting. She put them all, she threw them all around. And she's like, hey, take a look and see. And I looked, and I was like, oh my God, anything from here on my sides or peripheral was like bang on. Anything in this range in the front was an absolute mess. And I was like, wow, it's crazy, because when we started doing the somatic therapy, I was having a lot of like shaking and tremoring and a lot of like jaw movement. And then it was interesting because I noticed after I was able to, when we moved through it, I was able to remember names better. I was able to articulate better. And I wasn't bad, like as in like, like people make fun of, and when, football, the dumb football player from the 80s, like that. It wasn't bad like that, but I definitely noticed I was able to articulate better. I wouldn't have as much brain fog. I could remember phone numbers better, and food actually started to taste better, which is really interesting, because we dealt with the nervous system and allowed it to move through that and move through that trauma and move through all that stuff that I had. And I was in tears for like the first session. I was in tears for like an hour straight, which is crazy because we didn't talk about anything. So to tie onto your point, 100%. I think that's a really key point that gets missed, and sometimes it's tough because sometimes we don't know what we don't know. So I guess my question for you is, how do you bring that to the light with some of your patients or with some of your parents without, or rather even with your patient, how do you bring it to the light without labeling it or without them getting worried or upset?
Yeah, with pretty much every visit, I asked about like the family situation, like who lives at home and what the relationship's like, and then try to ask, you know, if the parents are separated, ask like what's the dynamic, do they see the other half, are they involved at all, and try to just dig a little deeper. And generally one of the questions is, has there been any sort of major life changes or stressors or traumatic events that have occurred in their life, to really get an understanding of the different sort of exposures they may have had. And then that's always in the back of my mind and in my note as a factor that may be affecting the situation. And sometimes it becomes clear that, you know, there's another issue going on, like there is a diagnosis or there is a medical problem, and we have to address that. But I never neglect the trauma that may be there. And so generally I will suggest, if it seems like it is having an impact on the present, that they do seek counseling. But it is difficult to access counseling often in Kelowna. I wish I had more training in counseling or any training in counseling, because like you said, it sounds like a lot of the situations that we're in with patients who come for, you know, these behavioral or mental health concerns is like counseling. And so I wish I had the, you know, more skills in that area to offer. But yeah, and sometimes it's clear that, you know, maybe there is risk for some of these other things going on, but it seems like potentially this trauma from the past is the reason for their challenges today. And in those cases, we try to talk about that more and say, you know, that I kind of explain like what our conversation was, and that we've learned that these different traumas linger and increase risks of all these other things. And another interesting thing is that trauma can be passed down generations. It seems that there's some evidence that they're seeing these genetic shifts or physical changes related to this trauma that not only is present in, you know, the parents who experienced it, but then into the children who haven't experienced it, and generational trauma. And so like that understanding that we're getting with this is really developing, and so when I explain those things, I think it helps to open their eyes. Okay, maybe there's more to it than we really think, because we're still learning more to fully understand it, and it kind of opens their eyes a little bit. And sometimes it ends up never really going anywhere. It wasn't, you know, maybe it wasn't a big factor, but other times, you know, they'll come back and say, yeah, I think we were right about this piece being a big factor. We've been addressing it more and looking for help, and we're finding it's been very helpful.
Yeah. No, I think that's I love that you're doing that. I think it's so powerful. And so we don't know what we don't know, right? Essentially what you're doing is you're like, hey, this is a possibility. And if it keeps getting ignored, it's gonna get bigger. You know, the term E meaning like energy, emotion. So if we have these trapped emotions, these trapped feelings, and that's what I think I would say from the outside listening, is that you're having a big impact is if you allow people to express their feelings, they get a chance to move through it. And that's what trauma is just not allowing to express it for whatever reason. And it's tough because you don't want to, especially I'm thinking of being in your shoes, it's like, oh, well, I can see that there was something, you know, there was this type of trauma or this. You don't want to start listing that unless they say it, but I'm sure in the back of your head you're going, yeah, I can see that, you know, A plus B plus C, like there's something here. So is there ways that you can, or that you help navigate a scenario like that? Or is it just, again, same thing, just asking those digging questions and seeing if they're willing to talk about it?
Yeah, very similar. Because, and again, like if the parents aren't ready to talk about something, because being in pediatrics, for most of the time, you're not only treating the patient, you're also, you know, a lot dealing with the parents, right?
Of course,
even a teenager, they're living at home, and their relationship with their parents is huge, and the life circumstances around the home is huge. whether there's financial struggles, if the parents are separated, if the parents hate each other, if one of them's a drug addict or one of them drinks a lot at home, like all of that affects the child. And so I often feel like I'm counseling the parents a lot too. And a great way to instill change in a child is to instill change in the parents, right?
Yes.
And vice versa too. I try to appeal to the child's kind of interest in helping their family too by, hey, if let's do this together. Like you start eating healthier and going on walks or making this change and bring your parents along for it. Like get them involved and make this change not only for yourself but for them too, and try to make it more of a team approach. I like what you had said earlier, and kind of drawing it back to this conversation. You mentioned that before kind of looking for that medical support, you're like, what are the main things that we can address first? And that's often what I try to do with my patients. It's like, okay, yes, you have anxiety or depression or ADHD, but let's make sure your sleep's on track. Let's improve your nutrition. Let's get you active. And let's address these traumas that you've had, because all of that is affecting you. I've been describing it kind of like a cup that fills and eventually overflows into whatever the issue is. ADHD symptoms or anxiety symptoms, having the past trauma on its own maybe doesn't cause it. Adding in poor sleep, maybe you're still okay. Adding in poor nutrition, maybe you're still okay. And then adding one other thing, now you're overflowing. And which thing? It wasn't any one of those factors, it was a combination of all of them. And so you need to address not just one by giving them a medication, but try to reduce every single component of that, because then you can have a much more substantial impact.
Absolutely. And I would say there, like, to add on to what you're talking about, the parents and counseling the parents and helping them, and the kids helping the parents, and vice versa, is a really good saying is that we are the sum average of the 5 to 7 people we spend the most time with.
Right.
So if your kid, if your parents are inactive and you spend a ton amount of time with them, it's an uphill battle, because your community, your tribe, whatever you want to call it, your group, your family, and it's not just necessarily family, it could be your neighbors or your aunts, uncles, whoever you're spending that time with. If they're not living that same lifestyle, it's going to be tougher, because we are programmed, our subconscious programming, which is 95% of our waking day, is programmed by the people around us, by the people that we're inundated with, by the information we're getting from social media, all this other stuff. Not to mention, if our parents are inactive, not eating well, the monkey see, monkey do, we follow them because that's what they do. So addressing, if I were to add to your little pyramid here, that's something too, is to look at the community. Look at who are you spending the most time with, and what kind of person are they? Because if your best friend that you spend time with is anxious and has anxiety and has suicidal thoughts and all these like negative things, and not eating well, not sleeping well, and all this, it's like, well, yeah, you're gonna become like them, because it's just how our brains work. We absorb that from around us. So you're getting a lot of input into their subconscious mind, which is what our programming. So addressing that, I would say, is a huge component in getting the parents on board, getting the closest people that they spend time with, not to give you advice, because I'm not, but that's my approach when I was in the fitness industry, was like, right, we're not just making a change in your life, like we need to change like your circle. We need to change all those people as best as we can, or at least get them on board, and not so you don't have to fight against them, because that's the worst. If you're fighting against them, that's even worse. If they're just neutral, well, that's not terrible, but if they're doing with you, well, then it's even easier, because I want pizza today. Well, the 3 other people in the family like, no, I don't want pizza. Pizza's gross. We want to let's make some of this. Let's make whatever. Oh yeah, okay, sure, and then we all do it, right?
Yeah.
So having that circle is so, I think, for addressing any emotional problem or any problem, really is so powerful, and something that's really changed my view on how I help people, and even for my own life, is looking at who I'm with, who do I spend time with, because I'm become like those people. So making sure I'm bringing in people that I really want to be like, or like aspects of, and then I say like turning down the volume of people that they are in your life. Let's say maybe it's family that you really do love, but I just turn the volume down because maybe I don't necessarily want to be like them. So to you've been putting out just a ton of like cool stuff. I'm honestly like, I'm sitting there thinking like, man, that's awesome. That was awesome. Like some great stuff, but to just kind of start winding it down, when you think of the term emotional fitness, what does that mean to you?
Yeah, emotional fitness, I think, to me means resilience and adaptability, and having a good understanding of yourself, and being capable of responding appropriately in different situations. And that is broad because obviously it's a broad term, but similar to physical fitness. Like somebody might have the strongest bench press or the strongest deadlift or be the fastest runner, but it doesn't mean that they're overall the physically fittest person, right? It's a broad range of things that they need to excel in to be overall physically fit. And it's the same for emotional fitness. You need to be resilient and be able to adapt to situations. I always thought of myself as like extremely emotionally fit and resilient, and that was one of the things that people pointed out about me, is like I was just always happy, never worried, and that probably was through high school and college, and at some point I feel like it started to sort of dwindle a little bit, but not obviously, and then it seemed like out of nowhere, like a couple of years ago with the transition back to Canada, there was a whole lot of change and a whole lot of added stress and different stuff going on, and those important things for emotional fitness I think had sort of dwindled over time, and so when life piled on, I wasn't ready to handle it, and I wasn't aware that my emotional fitness had kind of gone away, and then it was too late. And so I struggled a fair bit for a while, and now after putting a lot of time back into kind of myself and improving my overall health and wellness, finally I'm feeling more and more like the person I once was, feeling like I am more adaptable and resilient, but obviously it's a work in progress. It always is. But so you asked me before about seeing different things affecting life and having an immediate response, and I've seen that in myself, where I've had a lot of that strong emotional fitness, and then it kind of going away, and how that affected me, and now I've been working to build that back up and seeing how it has been helping me, and so not only did I get to kind of see that, I experienced it along the way.
And I think it's good that you experience that, because I think for all of us it's good to experience that, because it helps build resilience, and then realize it reinforces the practices. It reinforces like, no, I really need to do this because down there wasn't as good, and I like being over here. So aside from, because we talked about being physically fit, we talked about the nutrition, is there other little, call them Dr. Dan hacks that you do for your own self to help you just be able to handle? Because again, I think of being in these situations where you're talking to these parents, talking to these kids, you are, whether you like it or not, it sounds like you're counseling a lot of people, and you're taking in a lot of their emotional energy, and you're just there in all this. Plus you have your own wife who absolutely loves you, and you got a great family going on, but they need your attention too. What are other little hacks that you do or use to stay emotionally fit and just be able to handle these things that life throws at you?
For me, I've noticed sleep is very important. If I don't consistently get at least 7 hours of sleep, I function well within a 7 to 7.5 hour window, but I think optimally with about 8. But if I'm consistently not getting about 7 hours of sleep, I know I start to struggle. So trying to be more intentional about sleep is important for me. And then exercising has been the biggest factor, because that period where things kind of fell for me was the period where I wasn't active. And so that's been my biggest focus, is getting more physical activity, and being more intentional with that, and that has been very helpful for me. That's the main thing that I do for myself. Things have been very busy, like you mentioned, and so there's not a whole lot of time for other things, but I always have been making time for exercise and ensuring that I'm getting at least close to the 7 hour sleep threshold when I can. But with kids, you never know. It may be at like a few nights ago, 8.5. I was like, I can get a good sleep tonight. Allowed 8.5 hours of sleep.
Yeah.
But I got 6 because it was just a rough night for my daughter. So there's things you can't control, but setting up structures to make things as ideal as possible, as much of the time as possible, is important. Another thing that I've been focusing on a lot more is my nutrition. I talk about these things with people, and I feel I should be practicing it too, right? And I have noticed a big improvement in myself with eating healthier, and for the first time in my life, I finally meal prepped, and I love it now. It's awesome because I can eat really well any day I want with no effort because I did it already. And so that's been huge for me.
I love that. Figured it out as an adult. There we go.
Yeah, finally.
No, that's huge.
So that's been good.
Yeah, a really good saying from a lady that was on the podcast a few back. It was so simple. It was systems set me free. So when you have these like systems in place to like, okay, I go to bed at this time, and she was talking about exercising because that was one that was she previously struggled with. So when my alarm clock goes off, my shoes are right there, and then I got this, and then I have this, and these little steps. So something for you, something as simple as like meal prepping. It's a system in place to make sure you're able to do that. And I think one thing for myself that I really haven't talked about a ton of is just having, like, we both play on the same football team, which I love, but having that community, having that energy and excitement, win or lose, to be honest, it's just having an outlet to just like unplug from the world, and we're just out there, we're just athletes being athletes, and let's just go and like play and like not have to worry about the kids or the wife and the work and none of that stuff, and just go and to have that bond about that, for me, is really huge. Like, and that was something I've told Emily multiple times. It's like it's a core value of mine, having like that excitement, and having that competitiveness, being able to just compete in something, not necessarily to beat somebody else, but just for myself to just be like, I'm going to do my absolute best and just absolutely kill it. For me, that's a really, I know I don't need it in big doses. I don't need it, I used to need it in my 20s, like every day. Now I'm like, no, I can have like once or twice a week, even just once a week is good. But for me, that's something that emotionally fills me up, because I can let all that extra juice, that testosterone, all that kind of competitiveness out in a way that's really healthy, and that pushes me, and ultimately I feel better with it. So awesome. Any parting words of wisdom for any kids out there, or that we haven't already talked about, or parents, before we wrap this up?
Well, one thing that was still on my mind that I think helped me a lot with my transition from struggling more mentally was just how powerful being intentional about something is.
Okay.
A total mindset shift to doing something that's just like a routine or mundane activity or action, but doing it with intention or purpose, or intention and purpose. Even just doing the same things that I do all the time, but doing it with intention and purpose, gave me so much more it was so much more fulfilling.
Really?
Like, for example, regular chores that I do that I end up putting off, or I'll do it later, I'll get around to it, and then you start to feel bad because you haven't done it yet, and then you should have done it 2 days ago, and but that moment where you think, oh, that has to get done, I'm going to do that right now, and I'm going to do it because it has to be done, and I'm intentionally going out of my way to get that done when I thought about it, because I know that that's the best thing to do. And doing things with intention and purpose, getting yourself ready for the day, trying to don't just throw something on, but be like, well, is the collar right? Like, do I like these shoes? Like, that seems kind of silly and maybe vain, but like the intention that you're putting into something,
I like that, fills
you up and gives you that satisfaction. Your meals, you're making a meal, put intention into it. Don't just pick a couple things and throw it together. Like, be intentional about it. And when you're intentional about things, I found that it's just so much more powerful, and has had for sure a big impact on me.
I love that. It's interesting you talk about even just prepping for your day. Brian Tracy talks about having even just the act of prepping to do work, you will be more productive, which is just weird concept to think of. So my point there is, when we're productive, especially for men, but most people, I think, when you're productive and you have days where you're like, I really just feel like I did a good job today, and you did your best. And like, truly, not like the cheesy, but like, no, I put my really good effort in.
Yeah.
It fills us up. Like, we feel really good emotionally about that, even if you didn't necessarily get the results. Mm-hmm. But we really feel emotionally full from doing that. And and I like what you said even before, is the awareness. Because that was the first thing that came to my head is again, doing an intention. The word that came to my mind is awareness of like, I get to do this, and I'm being aware that I'm living in this moment and enjoying it. It's not, I have to drive the kids to school, and I get to it. And for me, it was having that shift of language. So it wasn't, I have to. Oh, I have to do this, I have to do this, I have to do this. It's like, I get to. Yeah. And we're still working on it. After this, we get to take the dogs to the park, right? We get to make dinner. And if you have that shift in language, which is so powerful, because language shapes us. But even though it's just anybody using that, is just move away from I have to and I get to. Yeah. I want to. Or I'm excited to, if you can really go that far. But even just that subtle shift, yeah, it really changes it, because now you become, I think that's, I would say, to kind of be a precursor that you were talking about, is if you have that language shift, it's easier to do that. It's easier to really be intentional about what you're doing and how you're doing it and why you're doing it. It's like, no, I get to clean I have windows. This is actually kind of cool. I like my house. You know what? Yeah. I've never looked at my window this way. Or, we got a garden in the back. It's pretty damn cool. Like, we're growing our own fruit. It's actually kind of wild to think about, right? Just little things that you can really take time to just appreciate and just notice that, like, hey, this is a cool thing. And why not? Why not appreciate the little things? Because if we can appreciate the little things, those big things, I would say, are just going to be just gravy. So, Dan, if anybody wanted to reach out to you, or if they haven't, maybe there's somebody in Kelowna that is needing some help with one of their kids, what's the best way to reach out to you? Or what, maybe do you have a clinic that they can go to or reach out to?
Yeah. So I work through one of the MedLive offices. Cool. For a family who had a child who wanted to see me, they would need a referral from their family doctor. Or
good to know. Doctor. I didn't know that.
And they would just request me, Dan Dobroskay.
Yeah, perfect.
For that. Otherwise, I don't really have social media for that
good reason.
But I'll probably check out the comments in the video now and then. And so if somebody was really curious to connect, that would probably be a good way to do it. Awesome. Well, thank you so much for being here, man. I appreciate you. Thank you. We always hug it out at the end. Awesome. Thanks, buddy. It was a pleasure. Thank you so much for listening to this episode. I really appreciate you taking the time out of your busy day to do that. If you haven't yet, please subscribe. Please share, because that's what helps this podcast grow and be able to reach more people. And why wouldn't you want to share something like that with somebody if you really enjoyed it? If you haven't yet, I'd also encourage you to go to lifepurposely.ca. My wonderful wife, Emily, sends out weekly content to help you improve your life and to think differently and to make wonderful changes that can impact your life forever. So thank you again for listening, and I'll catch you on the next episode.